Nutrition screening and assessment, mealtime assistance and education at Bendigo Health. It is currently estimated that 40% of patients in hospital are malnourished. At Bendigo Health, nutrition screening and assessment policy states that all adults must be screened on admission and weekly thereafter using the malnutrition screening tool. Those at risk, so scoring greater than or equal to 2, must be referred to a dietitian and commenced on a high-energy, high-protein diet. The Plum Dome system. Those who require assistance with feeding are at increased risk of malnutrition. At Bendigo Health, they've implemented a Plum Dome policy where those who require mealtime assistance are easily identifiable. The aim of our project is to reduce the risk of malnutrition and associated negative outcomes in hospital through analysis of screening tools and mealtime assistance provided. Our objectives include auditing MST completion and MST policy compliance, developing an education module for staff, and auditing mealtime assistance.
Our study included 324 patients. We chose to include the majority of the wards and excluded any wards that were deemed inappropriate. We used the online medical record system to collect information about MST completion, dietetic referrals, and diet code changes. We found that 55% of all patients, 36% of new admissions, and 68% of patients admitted greater than a week had the MST completed. Of the MSTs that had a score of 2 or greater, 42% were referred to a dietitian and 8% were commenced on a high-energy, high-protein diet. 3% of patients admitted for greater than a week had the MST repeated.
So our Plum Dome audit included 12 patients that were on Plum Domes over 4 wards at Bendigo Health. We observed mealtime assistance at breakfast and lunchtime meal periods. We used TrackCare to assess the completion rate of activity of daily living forms and dietary requirement forms, and whether it was documented that the patient needed assistance and if they were allocated to a Plum Dome. Our audit found that 57% of patients had an ADL form completed, 12 patients were documented as needing assistance, and 11 of these patients were placed on a Plum Dome. 11 out of 12 patients on a Plum Dome were observed to receive assistance at both breakfast and lunch.
Our study findings may reflect a lack of education around the MST policy and malnutrition, nursing time constraints, or the assumption that it's not required for certain patient groups. Our results reflect similar studies which found that only 1/3 of patients at risk of malnutrition were referred to a dietitian. However, ESPEN and ASPEN guidelines both recommend that all patients at risk should receive nutrition intervention. Inadequate nutrition screening may result in poor recognition of malnutrition and the lack of dietetic intervention. Therefore, an improvement in nutrition screening at Bendigo Health is required. MST audit, some of the strengths were that it was a quick, convenient and accessible study with a large sample size, and a standardised method of data collection was used between researchers. Some limitations were that the patient lists were actively changing, the study was only completed once, and it was an objective study, so no qualitative data was collected.
The high compliance rate indicates that the Plum Dome program at Bendigo Health is effective at highlighting patients in need of mealtime assistance. This assistance reduces the risk of patients having inadequate intake in hospital, reducing their risk of malnutrition. The 57% ADL form completion rate indicates that there may be patients requiring mealtime assistance that are going unidentified, with only 12 out of 127 patients on Plum Domes. Although compliance with the Plum Dome system was high, these unidentified patients may be at increased risk of malnutrition. As the strengths of the study, data collected at both breakfast and lunch, so to increase the reliability of results. Direct observation method was used. So limitations of the study was the small sample size and that data was only collected on a single day for 2 mealtimes. Assistance may have also been provided at a later time when researchers were not present, therefore was not observed. Reporter bias.
Our recommendations include the introduction of an MST education module for staff, encouraging staff to complete the MST and ADL forms on admission and review these weekly, include instructions on the MST for the next steps if the score is 2 or greater, and to give allied health assistants the responsibility of completing MSTs and ADL forms.
These are some screenshots from the education module that we created for Bendigo Health. So for future research, a replication study of the Plum Dome audit with a larger sample size or longer duration, a follow-up MST study 3 months after the education module has been released, and further study auditing which patients on the ward require mealtime assistance and comparing this to hospital documentation.